So without any further ado, I'd like to introduce Nick from Swansea University. Nick is a registered social worker and is teaches on the social work course at Swansea. Since 2013, he's been leading on the Developing Evidence Enriched Practice DEEP programme and has collaborated with a number of organisations, including Social Care Wales and, of course, ourselves. Today, he's going to set out some of the challenges and successes around recording personal outcomes information in social care and introduce some of the recent guidance on recording these. So I think that we've probably got about 2/3 of the people in now. So Nick, if you'd like to make a start, I'll hand over to yourself.
Well, hello everyone. It's terrible. I'm always more nervous on Zoom than I'm in person, especially when you have black boxes. It's because you can't judge whether what you're saying is of interest to people. So what I say is, if it is of interest, stay, and if it's not of interest, do feel free to come and go as you please. I'm sure people will anyway. You don't need me to say that. But so it's just it's an hour and a half. I just wanted to explore well-being, this concept, because it's so central, isn't it? It's a word that we use in such everyday language. What do we mean by it? And particularly in relation to the outcomes, the link between the sort of well-being and how that relates to the sort of outcomes agenda and how and the national outcomes framework and all that sort of stuff. And then and also with a particular slant towards the end about performance, because so much of outcomes is driven by performance, and we want to sort of explore that and perhaps question whether that's how safe a territory that is really. But so what I thought we'd start is, if just by way of introducing yourselves, if you could just put in the chat, I've got your names here. You say my name is, and well-being to me is, just in a word. So one word for you about what well-being, if you could put well-being in a word, what would it be? So, for example, for me, I might put swimming, you see, and swimming for me is because I live by the sea. And then after a day on Zoom, the first thing I want to do is go down into the sea, and that's really important for me. So it's just that really, just to see what we've got in the chat. So I am, and well-being to me is crafting, daily yoga. We're getting some good ones here. Nature, writing short stories, that's lovely. Family, relationships, nature, music. Attention, that's interesting. Balance, time outdoors, content, happiness, opportunity to do things. These are really important things, aren't they? And you can see when you look through them, there's some similarities, but they're also unique. There's a lot of uniqueness, isn't there, in well-being? And this is sometimes the elusive quality of well-being. We try to sort of pin it down, but it shifts according to people and context. What else have we got? Cycling and health, very important, and being outdoors, content with things. So we can see it's a range of things. So I think straight away, especially when you think of the lovely Welsh government and they want to get their performance frameworks all sorted, this thing is quite a slippery fish, isn't it, to sort of engage with, really. So so that's what we wanted to explore today. Rescue cats, hey, lovely. That's nice. I've got a friend in North Wales who does a lot of that. So health, being outdoors. Okay, so what we're going to do, I'm just going to start by going through some slides really, but very short, it's 10 to 15 minute slides about well-being, just exploring it with you. And again, Helen's going to keep an eye if you want to put any questions in the chat. And then it's going to end with a little Menti poll. I want you to, hopefully if you've got a mobile phone, it's ideal, but we just want a Menti poll. And we'll stop there and see how we're getting on. So is that okay? So I'm going to start to share my screen. This is where it all goes terribly wrong. Slideshow from the beginning. Okay, hopefully you can all see that. Is that clear, Helen?
Yes, it is. We still have the issue with the little bar at the top, but we were trying to sort this out before the session. So please bear with us on this slight little technical grey box at the top. It shouldn't be obscuring too much of the slides.
Yeah, so a few years ago, I was fortunate. I was involved in a knowledge exchange program with it was ESRC funded project with Edinburgh University and Strathclyde University on meaningful and measurable, and I've got a reference to it at the end, but it's this idea of, you know, what's measurable but what's meaningful, and do they always come together? They don't always. Obviously this is a lovely meaningful interaction in a dementia care home, but how you get a measure of that in performance is the elusive thing, isn't it? So so we've done the chat. So what do we mean by well-being? Well, again, and apologies, because I'm sure most of you know this, but just to sort of touch base again, there's loads of literature on well-being, and I think it's it all boils down to basically two types of well-being. Basically, there are what they call hedonic well-being, which is short-term pleasures. So it might be watching a rugby match, or eating a nice box of chocolates, or even one chocolate, or it's this idea of pleasure, something that's pleasurable and enjoyable. And some of the stuff that you're posting in the chat falls under this, the sort of the importance of pleasure. And I'm always interested, do we look at that in social work? When you're a social work manager, what brings pleasure to your staff team isn't perhaps something we always think about, do we, in practice, which is important. And then the others, eudaimonic well-being, which is about having meaning and purpose and having long-term satisfactions. The latter is the one that makes people live longer. So it's having purpose and meaning that's really important. And this is a lovely example. It's an old one now. And I did see Jackie Turner in the list of delegates from Swansea, but this is a Swansea story of somebody with dementia in a care home, and their initial understanding of well-being was to make life pleasurable for older people. So they would give people toast, and they'd give them jam or marmalade. They'd have choice and control over what they wanted. But this person with dementia used to throw the toast on the floor, really, when they did that. But what they found is she wanted to butter the toast. That's what she wanted to do, and she wanted to give the toast to the staff. So that made the staff have to rethink the way they provided their support. They weren't there to look after her, she was there to look after them. So when you take a well-being approach, it does sometimes question what we do. It isn't always about helping people. So I give little lovely examples of a short-term pleasure. Cicely Saunders, this lovely quote, and she's the founder of the hospice movement. A hospital would insist on a strict diet for a dying diabetic patient. We serve chocolate cake. So again, it's this idea that, you know, perhaps especially towards the end of life, pleasure is a really important thing. And, you know, your sort of health outcomes aren't always top of the list. In terms of long-term satisfactions, one of my favorite quotes is by Viktor Frankl, who was, many of you all know, he was in a concentration camp during the war, and he understood how some people survived and some people were crushed by the experience, and those that survived were those who could redeem some kind of meaning from their suffering. So whether it be sharing their bread with the person next to them. And he has this lovely quote, "Those who have a why to live for can bear with almost any how." And this sometimes turns Maslow's hierarchy of needs upside down, because basically people with long-term conditions sometimes can put up and live with long-term conditions if they can redeem some kind of meaning and purpose in it. So it's actually the purpose and the meaning that's more important than the basic needs. So this is an important sort of consideration. But in terms of the sort of social policy agenda and thinking, well, there is this emphasis, they sort of link in well-being with independence, don't they? And this is an old quote again, but Sarah Rushira, who used to be the Older People's Commissioner, voice, choice and control are important to us all. They are about identity, self-determination, self-expression and human rights. The lack of them damages confidence, self-esteem and well-being. And it is important, isn't it, this word independence, but it's this mantra that's very powerful, and it's often linked to individual autonomy, isn't it? And being able to do things, and particularly in social care, doing things for yourself, which mean, you know, you don't call on services. But this is a quote from a Paralympic athlete, Nathan Stevens, and he was a lad from Bridgend, and he was hit by a train as a child, and he lost his legs, and he became an athlete, and he was involved in the Road to 2012 Olympics, and this was a quote on a poster I saw for the Olympics, and I thought it was quite powerful when it talks about what well-being means for Nathan. "When I lost my legs, it was right. What can we all still do together? Still play football and rugby with my friends, sitting on the floor as a goalkeeper, scooting myself around with a rugby ball in my hands." So for Nathan, it seemed less, doesn't it, about choice and control. It was much more about belonging and making a contribution. And sometimes we haven't been very good at this. We focus on, especially in this consumerist world where we see social care as something to be consumed rather than something that supports a meaningful life. So, And again, it's often reflected in the independent living movement, again, which has been hijacked by the individualization of care. This is from Mike Oliver, a quote from a good few years ago now, about the difference between independent living in the States and independent living in the UK. There's always been a distinction between what we mean by independent living in Britain and what they mean in the States. Independent living in America is organized around self-empowerment, individual rights, and the idea that in the land of the free and the home of the brave, all that, whatever, individuals, if they're given access under the law and constitution, can be independent. In contrast, in Britain, independent living entailed collective responsibilities for each other and a collective organization. It wasn't about individual self-empowerment. It was about individuals helping one another. Once you accept that notion, it seems to me you are beginning to question the foundations of the society in which we live. I think this is a really important thought for us in social care and about the way we work with people. I've been doing a lot of work around co-production and the evaluation of co-production for Welsh Government, and so much of this comes into this. And the discourse of care and consumerism can undermine this sense of collective well-being. I don't know if any of you follow Martin Webber, who's a social worker, academic, and a practitioner by background in mental health, and he's at York, University of York, and he's always worth looking up his work. He runs the International Centre for Social Mental Health Research, but he does regular blogs, and he did one recently here, which you can look at on the slide, when he refers to social work, and he brings in this idea of Ubuntu, that I am because we are, and he thinks that social work in England can learn a lot from this concept of Ubuntu, which comes from Africa, which is a much more collective way rather than a consumerist, individualistic way. It's a collective way of supporting well-being. And this lovely phrase, I am because we are. And I think this I am because we are has implications for us when we focus on well-being. So it's not, sometimes we think, oh, it's all about the people we work with, and it is about the people we work with, but it's also about the unpaid carers who support the people we work with, and it's also about the staff who work with the people. So this is again a cartoon I've used for many years, really, but it's this sure glad the whole isn't at our end. As you can see, it's in any system, everybody's got to have well-being. If you've basically got the managers of a social work team up here while the social workers are bailing out the boat, then it's no good. The boat's going to sink, isn't it? And it's the same. So it's this idea that well-being isn't something that you can individualize. It's an interdependent thing. And a person who really champions this for me in health services, he's a professor of old people's nursing in Sheffield University. He's retired now, but he lives on Anglesey. He's Mike Nolan. And he basically doesn't like the word person-centered care. He prefers the concept of relationship-centered care, because he says in relationship-centered care, you have to look at the interdependent well-being of service users, carers, and staff. So, and you can't look at one without looking at them all. And he says in a good, what he calls an enriched environment of care or an enriched environment of learning, it doesn't matter who you are, you must have a sense of security, you must feel safe. You must have a sense of continuity. So what you're doing makes some connection with your life, your past, and where you want to go. That you must have a sense of belonging, to feel a part of things, that you have a sense of purpose, that you have a sense of achievement. And last but not least, in fact, perhaps the most important, you have a sense of significance because you matter, not because of what you do, but because of who you are. So, and Mike says, this really applies to staff as much as it does to the people they support and the family carers they work with. And basically, you've got to balance this idea of interdependent well-being. He has this lovely phrase. He says, we shouldn't be focusing on quality of life, but rather quality of lives. So what I'm going to do now, it's we've got a little Mentimeter poll, if you're okay going to that. And I'm going to minimize this now and I'll have a look at my, so if I stop sharing. So can you see the Menti poll? You just go on your phone. If you've got your phone, you go on to menti.com and then you type in the code 40344097 and you'll find 6 questions there. So if you don't mind doing that, you go on the 6 questions. I'd like you to think about your role now. This is your well-being we want you to focus on. It's your well-being. And there are 6 questions, or 6 statements really, and you either want to strongly disagree or strongly agree. So I'm just going to, so if you have a look on that, I'm going to go on, I'm not used to this myself, so you've got 6 questions. You tick wherever you want on the bar, and then you press submit at the end, I think. Yeah, there's a word submit. So if you're happy to do that, I'm going to go now onto the Menti website and see your scores, and we'll have a little chat about what you're scoring, about your well-being as a practitioner. Okay. Let's have a go. I'm going to stop sharing. And so just take a few minutes. One that seems to be is lower than the others is I don't feel threatened or out of depth in any aspects of my work. And that's really important, isn't it? The first question is around that sense of security, that people need to feel safe. And that comes up, not surprisingly, isn't it? It comes up time that social work, well, and social care practitioners are often in an under-resourced, over-pressurized service, are often, stretched. And that's not a good place to be, is this? I have developed a close connection with my work colleagues. This is around a sense of belonging. And again, this is higher, but one of the things that's come up, I know with the pandemic, we've done some workshops. Again, this was with Swansea Council Children and Family Services, where new members of staff are joining, and they're joining on Zoom, and they don't know the team, and they're trying to sort of form relationships, but basically they only know people through Zoom conversations, which isn't always a good way of building connections. The nice thing here, it seems 4 is a bit higher. I've been able to bring some of my own ideas and interests into the work, and that's so important, because I think this word agency, that you've got some control over what you're doing is fantastic. Is really important. That links to your continuity. And the highest ones, which is right, and this should be the case, shouldn't it, for social work, strong sense of purpose and direction. And actually, it's lovely to see that people are getting a sense of achievement in or creating things in their work, and also that they feel appreciated and valued by others. So I will exit full screen and minimize that. So should we have some questions there? Have we got any questions? I'm not very good at doing this chat, so I'm hoping Helen will.
No, I was just wondering, are you able to share for those people who have used their phones, it is possible to get the results. I don't know, Nick, if you have the results of the
Oh yeah, can I do the share screen? I was looking, I should have shared that.
Yeah. You can actually get them emailed to you, or you can just view them on the
screen. Can you see that?
Yes.
Yeah. So one of the main ones to me that's an area of concern, isn't it? Because it's middling around 3, is this feeling out of depth in aspects of your work, and that needs to be explored, doesn't it, really? Because if you're not feeling safe, it's one of the most important things in your work, really. And it'd be nice to explore what brings purpose and direction and a sense of achievement. And oh, good, it works. I've never used that before, so thank you all for experimenting. It's actually quite simple, isn't it, Menti? It did seem simple to me. Thank you. Yeah. Okay. So have we got any questions?
There aren't any at the moment.
No.
So if you'd like to continue, unless anyone has a burning question they want to ask.
So what I wanted to do is go on to the well-being and how it links with the outcomes agenda. So we've explored sort of well-being and the fact that it is elusive, but it's also, you can start to categorize and frame it in broad ways, but often that needs to be done around interdependent well-being. I think that is so important, and it does get lost in this world we live in at the moment, which is all around I'm a consumer, and I'm doing some work with home care in North Wales. And it's really interesting because we've developed this consumerist model of home care. Like, I want my home care at 9 o'clock, and everybody wants the home care at 9 o'clock. And then you wonder why you haven't got flexible and responsive home care, really. So some of the folk up there are really exploring how do we have a more flexible home care that allows people to do different things depending on individuals' needs, and it's give and take. So you can't have something one day because Mrs. Smith down the road isn't doing so well, and you get that whole culture of a collective approach to care rather than the consumerist approach to care. Right, I'm going to share screen again and go back to this slideshow from current slide. Okay, so well-being and the current outcomes agenda. And this, I've titled this slide, "The Only Way is Up," because I do think the outcomes agenda, and it's not a wrong thing to do, but it's a limited or a partial way of understanding outcomes. It's always about making things better. It's always about change. It's always about improvement. And this really comes from health, because the whole discourse of health is around making people better. And that's good, isn't it? That's a really important thing. But again, if you go back to some of the work of Mike Nolan, he says that's because all the cutting edge nurses like to be in like intensive care, getting people better. They get a lot of satisfaction out of that. And then you get the next best thing is rehabilitation, where you get people, you know, you can't get them better, but you can get them rehabilitated. And that's really good. But then Mike says there are a whole lot of people who have long-term chronic conditions who won't be made better and can't be re-enabled. And what does well-being mean for them? And what do outcomes mean for them? Because they're not always about rehabilitation outcomes. And I think sometimes we need to understand that. Now, one of the studies, and it's an old study, is the Social Policy Research Unit at the University of York. And they explored outcomes. It was particularly in the context of older people, actually. But they made some really important discoveries, really, and that they found that there are basically three types of personal outcomes. And the first of these is the most obvious one, which is about change. So people do like things to improve and get better. But they found actually for a lot of people, just staying where they are is really important, this idea of a maintenance outcome. And so it brings into question, you know, when you always think, oh, how do you measure outcomes? Or we use distance travel tools. Well, if somebody's staying exactly the same they are for 10 years because of a home care service, how do you demonstrate that using an outcome star? You can't really. So it's really important. There's some outcomes are just staying where I am and not going backwards. Thanks very much. So it does point at, you know, it makes us think again about how we capture and measure that. And the other thing that people said, and this is actually most important, and other studies say this, that one of the most important outcomes from any kind of intervention, whether it's a social work intervention or a social care intervention or support service, is the way that the services and the people in the services make people feel. So in a care home, that people feel loved, they feel appreciated and valued. These are the outcomes that matter most to people. And again, they're not the sort of things you normally put on the distance travel tools, which are usually around functionality or activities or whatever. So there's this whole measure of the way services make people feel. And funnily enough, we've been doing a little bit of work in North Wales. They've got ICANN, they've got a mental health project across North Wales, which is trying to use a much more community-based, discursive, relational support to people in the early stages or experiencing mental health challenges. And what's come out time and time again is words like kindness and tenderness and the appreciation of just having somebody who listens and things like that. These are outcomes that are really important to people. So measuring outcomes, it really is capturing a slippery fish. And I want to stop sharing again now. I wanted to show you a little film, if that's okay. Now, because one of the things...
Now, we love to predict and control. It's a natural urge. Don't be too hard on it. From time to time, it gives rise to a civilization. From time to time, it gives rise to an utter mess. And I think what makes the difference is how we think about the world. In doing so, we create a model. What's it like? I know, it's like a machine. Yes, I know it doesn't look or behave like a machine, but let that pass. In order that it should be manageable and easier to understand, we simplify the complexity, shed the superabundant beauty, and focus simply on utility. We generalize the unique, which after all is all that actually exists. We take the apparently distinct parts out of the context, which alone gives them meaning. And eventually, voila, a working model of the world. Then we're surprised when we find we've got a dead duck. You see, we only know what the part is when we see it in its context, the whole, where it belongs. We need to know the whole to understand the part, just as much as the other way round. As Wittgenstein, amongst others, noted, we can't reduce anything to anything. Reductionism is a dead duck, rabbit. Little joke for Wittgenstein fans. Everything that exists does so in a context and can only be understood in that context, which gives it its meaning and makes it what it is, like the heart in the body or a fish in the sea. Take it out and it dies. So would an act of lovemaking or an act of worship or just a dinner with friends when seen through the laboratory window. I was struck a long time ago by how unhelpful it is to try to understand the world by taking things out of context, as if it were made up of bits and pieces like the bike in the garage. A once great poem ends up a heap of banal sentiments you could have heard down the pub. It's tough when someone you love dies, coupled to a clunky verse form of little interest. Yet the poem itself can electrify. Here is the ancient floor, foot-worn and hollowed and thin. Here was the former door where the dead feet walked in. And similarly, music is made up of notes that each on its own is completely meaningless. So the meaning can't be in them. Is it in the gaps then? It can't be, can it? Because those are just silences, which on their own mean nothing. Yet put them together, and you have a unique living whole, a new context in which they have new meaning. Say, Schubert's C major quintet, that could change your life.
Okay. So he's one of my heroes. He's a neuropsychologist and lives up on the Isle of Skye. But he talks about the left and right brain, and he says how the left brain is all around precision and measurement and certainty, and the right brain is much more nuanced, and it's about possibilities and about all those rich things that make the world go round, really. And he thinks that the new public management is pushing us more and more down the idea that everything we do can be measured and quantified and put in boxes. So does anybody want any comments or questions about that, what he said?
Roger's put a comment in the chat. The challenge of knowing and understanding the wider context. What a challenge for researchers and evaluators. I don't know, Robert, if you would like to join the conversation and just elaborate on that.
Anybody want to?
Yes, I mean, I haven't got an answer to that. It was just, I suppose, reinforcing the point, I guess, that what a challenge that is. You know, I haven't got an answer. It was just, I suppose, agreeing with that point. You know, and it's a very powerful point, I think.
Yeah, because I've been working with Welsh governments, and as you all probably know, performance has been one of these things that's sort of overshadowed a lot of social work and social care practice. And historically, it's always been around key performance indicators, isn't it? It's getting all those measures. I'm sure you'll all agree with me that so many of the measures, like how many care assessments have been done, they don't always capture what's needed. But now the Welsh government have tried to revise their performance framework, and they've got a new approach to performance, and they've got 3 strands. So they say, well, we still want some of the KPIs, so they've got those. And but they've got this second strand now, which they're just starting to work on. I don't know how aware everybody is of it, but it's around. They basically want people to capture and demonstrate experience and outcomes for the people we work with. So that's this. This is this tricky thing. They want to get some kind of measure, qualitative measure, about what difference we're making to people's lives. And thirdly, then, they want people, the third strand of the performance framework is going to be around engaging with research and evidence. So it's just in this context that I wanted to sort of have a bit of a conversation with you, because I think the danger is this rich thing that we've talked about, well-being, and especially when you talk about interdependent well-being and the fact that everything's connected to everything else, then how does that meet now with the performance agenda, which is trying to shift? It's almost trying to say, well, we know that the way we've driven performance hasn't always supported practice or even got a measure of what good social work looks like. How do we move towards a better way of capturing that. So that's what we wanted to explore in the breakout rooms, really. So it's this word reductionism, isn't it? And I like the sort of definition from the dictionary, and it underpins new public management, really. The practice of analysing and describing a complex phenomenon in terms of its simple or fundamental constituents, especially when this is said to provide a sufficient explanation. And as you heard what Ian McGilchrist said, is you're on really dangerous ground then if you start to take life and something as complex as social work or social care and try to dissect it, pull it apart to measure it and to quantify its effectiveness. So next slide. So what we're going to do for the breakout rooms, and we wanted you to put you in, and Sian is my saviour in this because she's going to help do all this, aren't you, Sian? I hope, is to put you into 4 breakout rooms, and each breakout room will have a different question, which is going to go into the chat. So I'm going to just run through the questions first to show you what they are. So breakout room 1, we'd like you to discuss as a group, can social services be held accountable for the well-being outcomes of the people they support? So that's the question we'd like you to explore for 10 minutes. And I'd like you to reflect in that on what's often said, this debate between attribution versus contribution. So does social work and social care, can you say something's happened directly because I attribute to social work, or is it much more nuanced? Do you have to say, well, social work contributes, and if so, what's the implications there for how we get a measure of how social work's promoting well-being or its place in promoting well-being? So that's breakout room 1. Can social services be held accountable for the well-being outcomes of the people they support? Breakout room 2 is a different question. It's can we predict well-being outcomes, and is progress always linear? So this is a bit of a discussion we'd like to know about when you're also working with people. Is it all about setting the outcomes in advance and plotting them on a little chart and putting a metric score to them? Or is it much more emergent? And do people travel on a linear journey? Do they get progressively better? Or do they go up and down? And if so, what's the implications there? I mean, for how we engage with well-being outcomes. So can we predict well-being outcomes? And is progress always linear? So that's breakout room 2. Breakout room 3, and this is, what is our focus in capturing well-being outcomes? What is it? Why are we doing it? Why do we need to do it rather than just do it? Why do we need to capture it in terms of recording? And this brings on I'd like you to think about this debate around, are we focused on proving how marvellous we are, or are we focused on improving what we do? Because I think this will have implications for the way we focus on things. If you're always focusing on proving, and I know it myself when I was a team manager in Ulster Gunlois, it's you meet the metrics, you meet the score, so you learn how to play the numbers to demonstrate that you're achieving the target. So but you might not necessarily be learning much. So it's this debate, what is our focus in capturing wellbeing outcomes, proving versus improving? And the breakout room 4 is this question, should we separate out individual outcomes, or should we engage with them as a whole? And this really, I'd like you to reflect on the idea that if we're looking at what difference we're making to people's lives, do we try and pull the threads out like an outcome star and measure numbers and put them into numbers, or do we need to look at people's stories? And if we need to look at stories, well, what are the implications there for the way we demonstrate what difference we're making to people's lives? So should we separate out outcomes and measure them, or should we engage with them as a whole, as a narrative? So I'm going to stop sharing there.
To Nick then.
Great. So from breakout room 1, do people know which room they're in? And that's the can social services be held accountable for the wellbeing outcomes of the people they support? Does anybody want to feedback on that question?
I was in that group with Yvonne and Iona. I'll kick off, and the other two might want to add something. I think we agreed that social services was accountable for what it did in relation to contributing to helping people with their wellbeing outcomes, but it wasn't overall accountable, because the people we're supporting are, individuals with rights. It's up to them whether they choose to make use of this or not. Yeah, and we agreed it was a question, and in fact all the questions are questions we'd like answers to ourselves. So they were all very spot on in terms of some of the dilemmas around. Yvonne, do you want to add anything to what I've said, or Iona?
No, I think you got it right. Yes, we are accountable for what we do and how we do it, because we have professional standards. But at the end of the day, the individuals we're working with are adults, and they have the right to make choices, even wrong choices. So it's the second one that began with C that I can't remember. Contributing, that's it. Thank you.
That's a good question, isn't it? Because it raises all those systemic things. Like after 10 years of austerity, why are people supported by social services not doing so well? What do you think? Well, it might actually not be to the social services, but there might be other factors. And I'm sure Jackie would say about resources in adult services. You know, about.
We also, though, noted that, you know, social services is also about doing no harm. You know, by the very fact that social services is paid for, whether it's in the voluntary or, most social services are paid for out of public funds. Social workers are doing things on behalf of the state. And, you know, we know, if we look back, certainly over my long career, you know, there are circumstances. I come from the children's services background where we have done harm. You know, so we also need to recognise that, you know, there are lots of good intentions, but sometimes it's not the best thing for people at that time.
Thank you. Any other comments from the group, or should we go to group 2? Group 2, this was the question. Group 2, can we predict wellbeing outcomes, and is progress always linear? And this idea that, you know, should we be measuring distance travelled, or is life a bit of an up and down? Who was in this group? Oh. We haven't lost that. Is that a group we've lost? Is there anybody from group 2? That's Neris put a hand up, but I think it's to scratch her head.
Yeah, I was in group 2.
We were in group 2.
Yeah,
and I was, Jess. Yeah,
be brave. Sorry. Say what you think. You know, I don't know.
I think we had a discussion, Nick, around kind of, you know, it was about, you can't predict it linear, but we talked about the scoring as well. And actually, if it's seen as, you know, part of that discussion and it aids the discussion, it can be a useful tool, but very often it becomes, you know, a point that's raised perhaps at a review, or, you know, it feels like it's something at the, you know, an end of a discussion, and a sort of a tick box and a pressure being there to kind of score. You know, we had an example in the group where we were talking, you know, and one of the, I think it was Jen was saying, you know, she's never been asked about schools, you know, or her son or anything. It's always something that's filled in, and it doesn't equate to anything, and it's meaningless to them. So it's about how it becomes part of the intervention. But we were very much saying it is about the story as well, and we understand that we've got performance and we have to look at how we're accountable to that. But you know, you have to understand the underlying story around this as well. And we all have wobbles we do in our own daily lives. So why would people in using services be any different? And that needs to be understood in the context. And we raised the fact that you'd very much, you know, we've talked about, it's not always about change outcomes, it's about maintenance, and it's about process. So it's about being able to capture that and the whole story, I think. So yeah, we just had a bit of a really good discussion around it.
Another thing,
I hope
Jess,
that's true. We've got that right.
Another thing, Jess, that came out of some of our workshops around the Friend Not Foe guidance was the idea that you can always, some of the best outcomes, and we're finding this in mental health. I'm just a bit of work in mental health, but some of the outcomes are the unanticipated ones, the ones you didn't plan for. Yeah. And actually, if you focus purely on the things you planned in the first place, what about all these things that happen, that emerge, really, that come out of it, and especially where people grow in confidence or something. So
it's about keeping that record live, isn't it? That interaction with the individual live, and looking at those ups and downs and opportunities. And you know, an individual who is thriving, there will be more outcomes, new outcomes. And there's, you know, where someone's going through a very difficult period in their life, perhaps, you know, that their ability to achieve the things that they want to is way more limited. But there's a number of circumstances around doing that, isn't it?
Yeah, so outcomes are changing and they're morphing, aren't they? They're a bit like the coronavirus. They morph and they become slightly different, or they spur other outcomes. And again, the performance people don't seem to understand that. They just think, go back to that thing that you wrote in the first place and get a measure. And so,
Sorry, I was in the group, and just to, I think Jess said it all, but it was, it was very much like the old song. It's not what you do, it's the way that you do it. And I think we did feel that if the numbers can be a catalyst for a quality conversation, then that can be useful. But certainly, people's lives do go up and down. And
Okay, so should we go to breakout room 3? This was, what is our focus in capturing outcomes? Is it all about proving, or is it about improving? Group 3. And do be brave, because I feel totally insecure and not know what I'm talking about. So don't feel
I was waiting to see if somebody else was going to speak up, but I'll speak up. Hiya, Nick. We had an interesting discussion because we felt it was a bit of both, really, about that there's an aspect of proving that the services or the plan around the person was working, was correct, whether it needed adjusting or whether services needed to be changed for any reason. And then there's an aspect of that about recycling services that are available for other people. So there is a role for proving, but we're also talking about improving in relation to both practice, so in relation to service provision and improving service provision. We were reflecting quite a bit about how that had changed in our careers, how services had changed, moved on, improved. But also, I guess, in relation to outcomes for the person, whether they want to improve, change their own outcomes. So there's the two aspects there as well. Does anybody else want to chip in that's in the group?
I think somebody said also about how with the outcomes, how they could change with the person's journey, in terms of the beginning, if with their maybe low level needs and the support we put in but then as time goes on and things change and maybe that person deteriorates, the more support, and how some people also want to maintain just, a certain level of outcome. They don't want to, they don't want it to go further or down. They just want to try and maintain that steady level. So that we also discussed about the person as well.
Great. Thank you much. Any more from group 3, or we go to group 4? Group 4. So the group 4 was should we separate outcomes? This idea, do you pull them all out like personally, like making a positive contribution to society and feeling safe, or should we pull them all out, or do we engage them as a whole? So it's this idea that when you engage as a whole, the only way to do that is through story. And I didn't know whether people thought story or numbers. What about this group number 4?
So I think we felt, I was in a group with myself, Robert, Chris, Louisa and Wendy. I think we all pretty much felt that they're very complementary. We don't have to have a qual versus quant debate anymore, and there's lots of really good quality mixed methods research, but I think what we felt in reality, what happens on the ground is we're heavily reliant on academics to provide high quality qualitative work for us, and we're often in service delivery driven by numbers requested from Welsh Government. That can be very politically driven and very numbers based, and there is then the risk of service users' voices and those lived experiences being given less value and kind of being lost as well. And also, I guess, financial demands on kind of high quality evaluations. But, we were also saying how, data, particularly during the pandemic, and those numbers have been important to us in service delivery, but we've then lost what it meant for the service user and just didn't have that time to kind of work to capture that really. I think we felt that there was scope for both, and it shouldn't be seen as a conflict.
Does anybody else in group 4 want to chip in? Thank you, Holly.
No, I think that was a summary of our discussion. Thanks, Holly.
Great. Okay, so what I thought we've got the last half hour, is I just wanted to share, and only not in great detail, just to share some different approaches to capturing well-being and in different contexts, really, just to show. And to be honest, some of these address some of what you've been saying, really. Some do we focus on things we can code and quantify, or things we can measure? So it's just, you might be familiar with some of them, but I just wanted to run through them as an introduction. And if anybody wants more information on any of them, I'm happy to provide that. Is that okay? So I'm going to go back to sharing the screen. Right, so basically it's a mixed bag of this, and again, I think it's important what you say there, that we don't sort of polarize and say it's all about the qualitative or it's all about the quantitative. They've all got their strengths and weaknesses, really, and it is actually probably like anything, isn't it? It's when you actually balance them all in a nice mixed bag of stuff that you get the best measure of what's going on. So so the first one I want to talk about, are people aware of the What Works Wellbeing website? Because it's worth looking at. There's lots of stuff in there, and they talk about personal well-being, and one of the things, this is just one, they've got a whole list of different things you can look at. It's a very simple little survey. Some people, they want to do a very quick survey about a measure of well-being. It's the ONS 4 measures, they call them, and it basically just asks these 4 questions on a scale of 1 to 10. So overall, how satisfied are you with your life nowadays? Overall, to what extent do you feel that things you do in your life are worthwhile? Overall, how happy did you feel yesterday? And on a scale of 0, where 0 is not at all anxious, to 10 is completely anxious, how anxious did you feel yesterday? So it's a very simple little thing, but yeah, it's quite good, because we've had some people who are doing a little survey in the third sector, like around community connectors, and they want something really simple and light touch, and they just say a sort of before and after measure, and these sort of things might be useful for that. I don't know, you might like them, you might dislike them, but if you want to explore them, you can go into the What Works Wellbeing website to have a look. The thing about these, they have been tested, so some might look at that straight away and say, well, that's a bit simplistic, it's a bit superficial, but actually they have tested it, and they find that these questions are reliable. They are useful questions to ask. So they're not just written on a cigarette packet, because that's the danger. I think some authorities I've worked with, because people are busy, they just almost come up with the questions themselves on a cigarette packet, when actually you can go to a range of well-being. There are more complicated ones, which again, the more in depth they go, the more onerous they become, really. So again, it's this measure of what's actually practicable, because I think in fast-paced social care, where you've got busy practitioners, less is always more, really, because you can do all these great things, but really leave that to researchers. When you're in practice, you've got to keep it simple, haven't you? Otherwise it just becomes onerous. The second little tool, and this is one tool I really like, because it was actually an example of a co-designed. It's basically based on some research by a researcher called Mark Wilberforce in York University. It's called the Percy tool. And Mark is really interested in person-centered care and what it means, because again, it's this thing that we use all the time. We're all person-centered, but one person's person-centered is another person's not person-centered. And basically, he's explored what do we mean by person-centered care, and then working with, this was in the context of adult day services. What does person-centered care mean to you? And basically, it's a simple little questionnaire. It's free to download, and it asks 6 questions. The first 6 questions are actually about the care workers that support people. So this is really interesting. It's actually focusing on the quality of the care that's provided. And then the second set of 6 questions are all about the care and support overall. And they're really simple questions, like, they treat me with kindness as though I matter to them. They can tell my bad days. These are simple questions, but these are things that create well-being in people supported by services. And I know quite a few service providers I'm working with in different authorities having a look at this tool, and they think it's quite a nice little way they can get a measure of how person-centered their services, whether it be a home care service or whether it be a care and support at home. It could be in children's services as well, I don't know, but it's called the Percy tool, and you can Google it and download it. But I like it because it's no jargon, and it's dead simple, and I like the fact that it was actually co-designed with people supported by services. It wasn't just somebody thinking, some very erudite academic who understands what well-being means. The third one, and this is one that I really like, and it's called experience-based co-design. And this basically comes out of the work of Glenn Roberts in King's College in London, who's really interested in improvement. That's his thing. He thinks any kind of metrics you gather, or anything you gather really, should be focused on improvement and health service improvement. And he criticizes satisfaction surveys, because he says, okay, you get a hospital and they say 46% of patients had a reasonably good experience, you know, tick box, whatever. He says, well, what can you do with that, really? It's okay if you want to prove that you're reasonably good, but you can't actually do anything with it. And he says, good care and people isn't a, you know, it isn't what the care pathway looks like. It might look brilliant on paper. He says what counts are people's experiences. Their well-being is always illustrated through their experiences of their journey through the care system. So and what you'll find is there's lots of bland stuff. If you go into hospital at the start and come out at the end, there'll be loads of boring stuff. But he says there'll be things that made people feel good, and there'll be things that made people feel bad in hospital. There might be little things that totally other people are unaware of. But what you need to do is capture these. He calls them emotional touch points. So basically, when somebody's been in hospital, you ask them, what are your high points? What were the things that made you feel good in hospital? What were the things that made you feel bad? And they invariably come out with little narratives. And a lot of his research illustrates some of these beautiful narratives, which I've got some to share, but I can't do that. But we've adapted it into a very simple program called Magic and Tragic Moments. And we just get people to initially talk about whether people are involved in a service. We talk about their high points and their low points. It can be staff as well as practitioners. And then you use these little micro narratives, we call them, little mini stories, to explore what's that saying then, you know, so what's that saying about the way we do things around here. So it's very much focused on improvement and learning. And again, we've done a lot of work in magic and tragic moments, which I'd be happy to share with you. It's part of our developing evidence-rich practice program work. And then the last one, where's it done that? What's it doing now? Oh God, no, what have I done? Hang on. I clicked on the link. It did the hyperlink. There you go. Let me go back to current slide. Yeah, and the last one is this most significant change, and this is a thing that I found really interesting. We've been working with we've been working with third sector community organisations like Community Connectors and the likes in West Wales and in Monmouthshire, and also some mental health work up in North Wales, where you've got a programme where you're trying to make things better. So a lot of local authorities are trying to sort of say, well, we're going to do prevention and well-being better. We're going to keep people out of services, and we're going to do it by this. But they're not really quite sure whether it's making a difference, you know, because you can put up money into preventative services, but is it really, what difference is it making? You know, so they've been using this technique called most significant change, which comes out of public health, and it comes out of community development. And what happens is in community development, you might have some change program where you're putting a bit of money into a project, an initiative, but the outcomes aren't always that easy to predict in community development. Some of the most important outcomes are the ones you don't anticipate, and some of your intended outcomes can be the ones that actually throw a spanner in the works. So most significant change, basically, instead of looking forward in terms of your planning, what difference you're making, you look backwards, and you basically ask a very simple question. You say, okay, over the last 6 months, as a result of the Community Connectors project, what good or bad changes have come about? And you get people to tell a story then. They say, well, this has changed. I feel more confident. I go on the bus now and I never used to, or whatever. They list a number of changes. And then you say, okay, out of all of those changes, which is the most significant change to you, and why is that? So you end up getting this very personal narrative. People say, well, actually, the most significant change for me is this, and it's because of this. And then you say, well, what was it like before? What's it like now? And what do you think brought about the change? And then people tell you they analyse their own stories. You don't analyse them. They analyse their own stories. And then they give their story a snappy title. And you end up with these little short narratives, structured narratives of most significant change. And then what they do in most significant change is you get the decision makers, the people with influence. They have to look at these stories and talk about them together, and then decide which is the most significant story. And that's not like a competition. It's to help them to wrestle with each other, right? What's going on in these stories? What's it saying about the way we're doing things? So and they produce a feedback report, which they have to then send back to the people who gave their stories. And it says, well, we chose this story as the most significant, and this is why we chose it. This is what we learned from all of the stories, and this is what we're going to do about it. So it's very action focused. So that's a really nice methodology, and I'm always interested in how adaptable that is to a social work sort of setting. Definitely it's used in any kind of developmental work. So that's it really. And then the last thing is, and Jess can say more about this, is I'm working with Jess and others in Social Care Wales and Emma Miller up in Scotland. We did some workshops, and some of you came to the workshops around outcomes recording. And sorry, the phone's going and my dog's all crying now. So, but anyway, we're working on this document called Friend Not Foe, which we can share with you. And we're trying to develop some basic guidance around how do we record outcomes in a meaningful way. So I'm going to stop there and probably mute myself because you don't want to hear the dog whining and the phone ringing. Jess, do you want to say any more about that? If you're there, are you there? She might not be. No, I think she's gone, isn't she? So any comments on any of those methodologies? Any thoughts? Do you like the sound of some of them? Do you not?
Nick, sorry, I'm sorry to be a pain, but could you put that last slide up? I couldn't hear or see, you know, it was all very confusing with the phone going and everything.
Oh, sorry.
And I missed what you said about the last slide. It was a green report.
Yeah, can you see that?
Yeah, okay. So can you just tell me a little bit about what it is?
Yeah, so basically Social Care Wales, for years now, have been promoting a personal outcomes approach, haven't they, to practice. So a lot of that's linked with Rhoda Emlyn Jones's work around, you know, the conversation, all of that. But what they found in Social Care Wales in that work is that whilst the practice was changing, the recording was lagging behind really, and not necessarily blaming practitioners for that, but often saying the system, especially when it's all in a sort of, it's all based on ICT, the way things are recorded doesn't always demonstrate personal outcomes very well, really. It doesn't capture it. So they wanted to develop some guidance to help people. How do we do recording that it really does focus on personal outcomes? So we did 3 regional workshops across Wales and involved a lot of people in each of the events just before the pandemic, actually it was. So we were lucky to get away with them. It was almost like a week or 2 before lockdown came. And basically, we got a lot of evidence from practitioners and managers and people supported by services. And then we also looked at the research literature. And then basically, we've pulled together this guidance, and it's called Friend Not Foe. And it doesn't tell people what to do, because that's, again, the classic thing you don't do, isn't it, with personal outcomes? But it outlines, I think it's 12 principles. It's 12 or 14, I can't remember now. But there are these principles, and then we've tried to illustrate what the principles look like in practice. And Social Care Wales at the moment are testing out this guidance with practitioners in different settings. So, for example, I'm doing a little bit of work around domiciliary care and what meaningful recording looks like in home care, because most home care, they just have to write what they've done, a list of tasks, because if they don't write down what they've done, it hasn't been done. There's nothing meaningful or reflective, really, in the way they record. So how can we make recording interesting for home care workers is one. But I know
does this cover children's services as well as adult services? Yeah, great. Okay.
Jeff Bratton-Wilson has been having some conversations. Jeff works in Social Care Wales with children's services. So yes, definitely.
Brilliant. Lovely, thank you.
The idea is it's across the board. It doesn't matter whether you're adult social work, children family social work, or social care provision.
Right.
These principles should fly. I mean, one of the classic principles is that things should be joined up across the system. So you can't have social workers thinking one world and then providers working in a totally different world. There needs to be some join up across the system, especially where social workers are commissioning work that goes out to providers. There needs to be some continuity. So that's what that's about. Yeah.
Thanks very much, Nick. Sounds useful.
Yeah. So we can share it. I don't know. Yeah. So I think it's just a test document. If anybody's interested, I can send it to I'll send it to Sian.
Yeah, if you send it to us and we can disseminate the link afterwards.
Yeah, it's only a test document. It's not official yet, whatever, but it's a test. I'm sure I'll check with Jess first. You know, I don't want Social Care Wales like whether we can share. Personally, I say share anything at any time with anyone, but I don't know whether Social Care Wales are happy with that, but I think they should be. I can't see why not. Yeah. What about any of the other methodologies? Anything sort of the story ones, or the numbers ones, or the little Percy tool? Or what do people think about any of those? We could have Roger, but he's doing a separate talk on an exchange event about his tools.
I was interested to see that Percy tool, sort of asking people about it's kind of like relational well-being, isn't it? Asking people about their relationships with important people in their lives and how that impacts on well-being. And I noticed that Chris has put in the chat about her husband coming out of hospital, and his interactions with people in the hospital were really good. And how do you measure that? And I suppose that just struck me as one way of, oh, I've got noise in the background now. Sorry, somebody working with tools outside.
Yeah.
So yeah, the relational well-being, but also for me, I'm interested in community well-being, and I was thinking, how could you possibly measure that? But again, it's perhaps not measuring something objective, but asking people how do they feel in their community, and what do they think about their community, and their sense of belonging, events when they felt good, events when they haven't felt good. So yeah, I found that really interesting.
Yeah, because the experience, the highs and the lows thing is really, I was working with Public Health Wales on and Cwmbran Cymru on them. They're developing dementia standards, and so we ran some workshops, and we got managers together with practitioners, with people living with dementia and unpaid carers, and we just started by saying, memory assessment services. Okay, you've all got experience. What are your magic moments from memory assessment services? Which was really interesting. So people individually write little stories, and then we got them in little groups, and then they had to share the stories with each other, and each little table then picked one story which they thought was the most magic moment. And then we did the same then with what's your tragic moments with memory assessment services. And again, people were very good at articulating their stories, and then we used those as a stimulus in the afternoon then for a discussion about, so what's this say about memory assessment services, and we came up with some principles and a way forward. So I think it can be onerous, but it's not necessarily onerous, because what I find, the storytelling approach, people engage with, because we're storytelling animals as human beings. We like stories, and we get energized by stories, even tragic stories. They have a hook in us. So although they take time, I think they reap rewards. Storytelling approaches reap rewards. Numbers, some people love numbers, but not everyone loves numbers. But numbers are important, but they don't always get them.
I was going to contribute. I actually, for those of you who don't know me, I'm perhaps a very extreme quantitative researcher. So I do love my numbers. And that's where Chris's comment in the post, in the chat, about the fact that how do you quantify that feeling of, I interact when, so everyone he interacted with was really good. He previously had a number of bad stays, and how do you score that? And it's the subjectivity or the relativity that makes it really quite interesting. We've got numbers. And I think for me, there's an element of, if you give something a score, it's great that you can then compare it like to the score the next day or the next week, and you can measure change that way. But really, that's only the starting point. And that's why I quite like your most significant change kind of idea, that you're asking why it's changed instead of just, what is the number now? What was it yesterday? Yeah. How is it in a few weeks' time? So for me, that bit was, it's quite challenging for the way that I normally think, but it was really interesting.
Well, they complement, because the guy who invented most significant change, Rick Davis, he says it's really important you don't put all your eggs into the most significant change basket. This just is one method, and he very much believes in quants as well. So he says, but this is a way of adding richness and colour to quantitative data. So I think it was a point somebody made earlier. We really don't want to polarize and say one or the other. We need both, don't we? That's it. It's how you get the balance of the two, really. And again, what's your purpose of it all? And I think the whole thing, it should be around learning, isn't it, and improvement. Because again, I think the proving agenda is a dangerous territory to go into, really. We need to encourage more honesty, and but that's hard, isn't it, when you've got a cash-strapped local authority that's driven by ever-increasing expectations that you're going to do a wonderful job. It's sometimes hard to be honest.
Just to throw in, Nick, as you would probably expect me to do, appreciative inquiry.
Yeah,
I've been using it over the past 10 years, really, and I have used it in evaluation scenarios. So some people I'm sure will be familiar with it, but I think you can use it as the part of an evaluation approach, because it is very much around storytelling. So there's a 5D element. There's 5 Ds, and one of the Ds is discover, and people talk about their experiences when things were working really well, and also why they were working really well. And there's other elements to it as well, but I would recommend that as an option for people, and it's worth looking at if you haven't. Yeah,
very much so. Yeah, great. So some of the stuff, because I'm working with Social Care Wales as well, and we're developing a curriculum around, it's called Developing Evidence Enriched Practice, and how we engage with different types of evidence, whatever that is, and put it into practice to make the world a better place, really. And Roger's working with us on that, aren't you? So, but that would, yeah. So I think we're probably done. You've all been really good, especially.
Yeah, we've got about 5 minutes of our allotted time left. So if anyone has any reflections, observations, or questions, now's your time to do it. Or if it's more in depth, if you'd rather ring or email Nick and do that on a one-to-one basis, that's fine. But it's just opportunity for the floor if anyone has got anything that they would like to contribute.
On the last slide, I've actually put the link. I haven't got the slide. I can put it up, but it's a link to the Meaningful and Measurable project, which is interesting. You can go onto the website for Meaningful and Measurable, and there are reports and summaries. So I'll just put that up.
Yeah.
If people are interested, and yeah, the Meaningful and Measurable project there. There's a, because that was we looked at all sorts of things around how you measure outcomes, and I think it's quite a nice, and there's actually a network now called the Personal Outcomes Network. It's mainly Scottish based, but again, if people are interested in the Personal Outcomes Network, you can join it, and it's convened by Emma Miller at University of Strathclyde, but a lot of practitioners are involved in that up in Scotland. It's quite a thriving community, really. It's called the PON, the Personal Outcomes Network Scotland. Okay.
So if there aren't any more questions from the floor, just to let you know, obviously this session has been recorded. So Sian and Rhiannon will be sorting all the technical side out. And so that will be available in a couple of weeks' time on our website. This has been one of a number of presentations that are part of the Wellbeing series. So if you'd like to see any of the other ones that we've already had, information can be found again on the website. And I could just encourage you to keep an eye out on social media for our forthcoming events. So all that's left for me to do is to thank Nick for a really, really interesting talk. So we could do that in the usual way of just giving a round of applause. And if anyone would like to, as they're leaving, to verbalise that, please feel free. Thank you very much.
Very much.
Really, really interesting.
Thank you all.